You know, we've obviously talked to a lot of both children and adults with asthma, and a pretty recurring theme has been a dread of gym class. Um,
Mhm.
that fear that they're going to start wheezing or coughing in class, and unfortunately sometimes unsympathetic gym teachers or coaches. Um, do you have any advice for parents or kids on trying to get over that fear and maybe handling a difficult situation?
Well, absolutely. I mean, we know that if we use the short-acting bronchodilators 15 minutes prior to exercise, that most times that will help prevent an exercise-induced asthma exacerbation. So on my asthma action plans, I always add that prior to gym class or prior to exertion, 15 minutes using 2 inhalations of the short-acting bronchodilator, and to let the parent and the patient know that also, so that they know that they'll be quote-unquote protected when they exercise. And then, of course, there are times when that's not enough if they're really exerting themselves or if they happen to be outside exposed to the tree pollen, that's one of their triggers. So I just let them know that they certainly can use a second dose. And that's why it's so important to have that inhaler available for asthmatic children. Oftentimes, I will also have the patient use the rescue inhaler in my office, and I'll do an exercise challenge so that they can sort of know what to expect. And that, again, empowers the patient to have better control of their asthma and a normal life. The other thing I let parents and patients know is that obesity now is defined as a chronic illness of its own, but it's also a comorbidity for asthmatics. It increases the risk of asthma due to hormone release of things such as leptin and other things. And it also changes the lung volumes, makes them lower, which of course doesn't make asthma any better. So we want to go to gym class, we want to go to physical education because we want to be in better shape. Obesity and asthma do not go well together.